Hello, everyone. Welcome to the Sarcoma Foundation of America's first education session of 2025. We're excited to kick off the year with this afternoon's discussion surrounding the adolescent and young adult sarcoma experience. My name's Christy Rishton. I'm the Program Manager for Engagement and Research at SFA, and I'm joined this afternoon by my colleague, Natasha Nathan, Program Manager for Engagement and Advocacy and AYA sarcoma survivor herself. We thank you for taking the time to join us for this important conversation. Before we begin, I'd like to briefly go over the format and logistical details of the webinar. Natasha will be serving as the moderator for today's session. We have two panelists who are experts in the care of adolescents and young adults with sarcoma at two partner institutions in the greater Boston area. Also joining us is a sarcoma patient sharing her experience as an AYA navigating life with sarcoma. Following their introductory comments, we'll open up to a panel discussion. At any time during today's session, you can submit your questions by entering them in the questions field at the bottom of your screen. I'll be standing by to share your questions with Natasha and our panelists. Please remember, our panelists will not be able to answer questions related to your specific medical situation, so make sure that they're related to the topics raised during the session. The information in this webinar is for educational and informational purposes only. It's not a substitute for medical advice from your physician and your care team. Today's session is being recorded, and a link will be posted to SFA's website. Finally, as a reminder, all participants are muted and questions must be posed in the Q&A box. Now, I will introduce you to our panel members. Jackie is a clinical social worker at Mass General Cancer Center, where she has been since the start of her career in 2016. She's developed a practice focusing on quality of life and advocacy for patients, families, and their varied needs. Jackie has a special clinical interest in the needs of the AYA population and has been involved in innovative individual and group approaches to supporting this population. Jackie was also honored by SFA at the 2024 Stand Up to Sarcoma Gala with the Compassionate Care Award. Caitlin is a clinical and programmatic social worker at the Dana-Farber Cancer Institute. In her clinical role, she provides supportive counseling to young adults in the Sarcoma Center. As a programmatic social worker, she's the community liaison for the psychosocial clinical supporting, the psychosocial clinic supporting patients and staff in navigating mental health resources. She's passionate about increasing access to healthcare services, decreasing stigma for mental health and disability rights. And finally, Valerie. Valerie is a leiomyosarcoma survivor and active member of the AYA sarcoma community. She joins us today to share her experience. Thank you all for joining us for this conversation. Valerie, I'm going to hand it off to you to get started.
Thank you, Christy. So I'm Valerie, and I am hopefully a 2-year net survivor for leiomyosarcoma. I'll find out hopefully next week sometime. I just had scans today. And in these 2 years, a lot of things have changed for me, particularly in sense of my identity. I'll backtrack. I felt my lump behind the knee in April of 2022, and I really didn't know anything about sarcomas or really that extremity lumps could be deadly. So I didn't go to my primary care physician or any doctor until June of that year. They thought it was a Baker's cyst, and really it wasn't until October of that year that I was diagnosed with sarcoma. And if you've been diagnosed with sarcoma, that's a good amount of months to know that it could make a difference. So I'm really making it my life's passion to be like, extremity lumps could be deadly. So get those looked at. I think the biggest change for me since being diagnosed is I didn't see myself past my treatment in the beginning. And I thought maybe if I did make it through, that it would just come back to life and just be normal again. But maybe the life that I had before that just wasn't there. And the longer it passed, the more unreachable it seemed. I couldn't really get back to that. And some things happened also during treatment that you kind of realize maybe that wasn't the good life that I was thinking I was fighting for to stay. The state that I found myself soon after survivorship was lost. I was like lost. I just felt lost. I was an educator before this, and I used to tell my students, your goal is not your purpose. And that's very easy to live by when you can still make goals and you can still see yourself in a future life. But when your future is very uncertain, that becomes really hard to do. And so making goals or having a purpose when you've lost a little bit of independence and your priorities change because now you're thinking about your life differently, just is a lot harder to practice of a mantra, so to say. The shift in priorities for me made it hard to connect to my friends and to relate to them because, sure, work, career, studying, all of that is important. But again, when you don't see your life past a certain point, um, what does it matter, in a way? And that really changed for me. I thought I had a quote unquote ambition and wanted to do something. And then I'm like, you know what? Maybe I don't. Maybe I just don't have that ambition anymore. So that priority shift really was impactful for me. Skin anxiety and anxiety in general, just when you get a rare cancer diagnosis, things that people say are unlikely to happen, you're like, well, it was unlikely the first time. So there is no stopping it to be unlikely the second time. Um, and it just makes you aware of other unlikely things. Another big point of anxiety or hyper awareness for me was that I did get radiation treatment, but my tumor didn't respond to radiation. And so, therefore, adjuvant chemo wasn't an option for me. And a lot of the times when you say this to people that don't understand sarcomas or don't know about sarcomas, say, oh, well, great, you didn't have to do chemo. That's awesome. And yes, in a way, because chemo is no pleasant tree to get through, but also the implications of the treatment resistance is not something that I thought of before when I didn't know much about sarcomas, but it's not something that I'm like, oh, happy I didn't have to go through chemo because now I have an additional concern that I really didn't have before, in terms of what is, if this comes back or when it comes back, what am I going to do? Or what is this going to look like the next time around? Um, so those are concerns and priorities that my peers perhaps don't have to think about. I'm also married. So when life changed and plans changed, it wasn't just my life plans that changed. It was also my partner's goals, dreams, future plans that changed. I'm sure he also wasn't expecting to have to help his wife, 30-something-year-old wife, do certain things, and get around with things, and be a medical advocate for her. And so there is a lot of guilt that comes from having a partner or somebody in your life, whether a parent or sibling, helping you with tasks, and you're seeing them sad or they try to hide it, but it's pretty obvious that they're hurting. And so that brings a lot of guilt. And sometimes you feel like, oh, I really hate to do this to you. But at the same time, and I know you're helping, I feel really lonely because I know this is only really happening to me. So if I die, I'm dying alone. And so it's a bit of like guilt for you supporting me, but also I feel so lonely because at the end of the day, it's just the consequences of the disease are just happening to both of us. And I feel really guilty about that. Um, I have found really wonderful ways to cope. I do. It's not all terrible. I've found a great community of other young adults that have been helpful. My social worker found different groups for me to join, including a local one where I was able to write a comedy skit about my experience. And I think it's been maybe a little bit over 500 people now that have heard this routine. And that is pretty empowering in the time where you feel really lost and that you don't know what you're doing with your life, to just leave it all on the stage and have people laugh at it with you. And like I said, I think life becomes really comical when you're facing the end of it. Kind of, I'm not at that stage, but when you're thinking about life or death, like the dance in between becomes really funny. And so laughing about that and having an audience right laugh at that with you has been pretty empowering of an experience in healing. So I love dark humor. Um, I love to journal because the thoughts don't stop ever. So it's good to journal, and I try to do that often. And sometimes when it gets really overwhelming, I literally just look at my feet and say, "You're alive now. What are you doing right now?" And I take it minute by minute to sort of get through the day, because sometimes life is overwhelming when cancer has occupied a lot of your cup, and just little life things, just even a drop, can overwhelm the cup. So it's a little bit of my story. I'll pass it, I think, to Christy or to take back. And I'm always excited to meet other sarcomies. It's actually part of my act when I meet another sarcomie. So.
I love that you use that term as well. And thank you so much, Valerie, for sharing that experience. You hit on pretty much every point that I could imagine for the adolescent young adult experience. And so much of that rings true. So we have Jackie and Caitlin who are also going to touch on so many of those things from the social worker perspective. And we'll have an opportunity to discuss all of this and ask questions at the end. So, but in the meantime, we'll pass it to Jackie.
Hi, everyone. Let me get set up real fast. Got my little cheat sheet on the side, so if you see me kind of looking away, that's what I'm doing. Yeah, so Val, that was a hard act to follow. I really appreciate you sharing your story, and the dark humor goes a long way. I would love to watch your stand-up if that's available. So yeah, so I'm going to start from the beginning in the sense of you get a diagnosis and kind of what happens. The slide here is more just like a visual of the different areas that get impacted and what can essentially what creates strong mental health in somebody. So there's spirituality, emotional well-being, financial well-being, physical well-being, fertility, sexual health, and social support. Everyone might have some additional kind of arms, if you will, but those are kind of the big ones. Also, I forgot to start my timer. I'm so sorry. Okay, because I might ramble. So let's see. So you receive a diagnosis of sarcoma, and life flips upside down and mostly comes to a screeching halt. You've likely been misdiagnosed, and Val has touched on that in the beginning of her story too, and or been dismissed by several doctors, providers, and or ED staff along the way. So it takes quite a bit of effort just to get to an actual diagnosis and to get to a team that says, yes, this is sarcoma, and we're going to help you through it. So once you get there, I hear a lot of slightly feeling relief in the sense of there's a name to all of the invisible suffering that you've been experiencing, and you can start to go, okay, this is what I have now. How do I move forward with it? And a lot of questions are going to arise in the sense of, why is this happening to me? How is this happening to me? Did I cause this? And am I going to die? You hear cancer, you hear death, and that's unfortunately kind of where we are as a society. So you're sitting there in the office with a doc that you may or may not like. You find out you have sarcoma. Finally, you get a name to the face. You're questioning yourself, are you going to die? And please know that all of those thoughts are normal, especially between 18 and 40 as a young adult. All of the life milestones, the ones that you plan for from, I don't know, like beyond, like elementary school beyond, right? So you probably just graduated from either high school or college, and you're looking for a career path, or you're wanting to find your dream job, or you recently got married, or you want to get married, and you want to have kids, and all of those things just kind of become a blur of, can I even do those things anymore? Is that even a possibility? It's not part of the plan. It's not part of anyone's plan. And then you feel isolated and alone. And Val kind of touched on that in the sense of, okay, what do I do with this? And one of the best things, one of the best guidance, I guess, that I can share is that if you know what you need, it's how do you communicate that with your loved ones, your friends, your family, and in figuring out, okay, is it a sense of like role reversal? Do I need to ask somebody to do the dishes, like you're like Val married in the sense, right? So maybe you did the dishes before, now the husband needs to help out, or wife or whoever, in the sense of like trying to make life work with this diagnosis. And another good question in the sense of, once you get this diagnosis, in a sense of like, are you needing empathy from your loved ones, or are you needing more of a concrete plan in the sense of help me problem solve? I need to find X, Y, and Z, right? So knowing the difference between what it is that you need as an individual, it's going to help your caregivers know how to best care for you, and it's going to help them feel a sense of purpose. And 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 nobody can go through this alone, nor do we encourage it. There's a lot of grief, there's a lot of trauma. It's a diagnosis of cancer. You kind of can't have that with either of those. And everything just kind of becomes a big pause. Let's see. I'm kind of a little bit, let's see, hold on. So I'm really starting in the beginning in the sense of what I think are good strategies and suggestions for any patient in the AYA population. So number one, feel all emotions, right? So there's no wrong emotion. Feel angry, feel sad, feel scared, and find a way to kind of voice that to yourself and maybe to others that are deserving of hearing it. Your voice is your best advocate in this. And unfortunately, it's probably the first time you've been to a medical appointment or a medical setting or a hospital, and you're having to navigate something that you've never had to do before. So figuring out, okay, what and how do I speak to my team about what's important to me, right? So what matters, purpose, finding ways to keep that going, even though it can be in a sense of despair. Not internalizing other people's discomfort around your diagnosis. So a lot of people have strong reactions, and it's not your job to counsel them through those reactions. Everyone has people in their immediate circle, and I encourage you to think about, what are you noticing maybe your family needs, and strongly encouraging them to seek their own mental health support, in the sense of it's not your role, and it's not your role, period. It's not your role. And then another thing that's important too, look at my notes, in the sense of when you meet with your medical team, a lot of times there's this regression in the sense of in the AYA population, right? You maybe have just moved out and you're living on your own, or you just moved in with your partner and you can no longer afford rent, or what have you. And a lot of folks I hear move back in with their parents. And it's this weird kind of, I was a 28-year-old, now I feel like I'm 14 again. And being able to kind of express and implement boundaries when needed too, to help you get the privacy you need, but also get the care you need with the providers, and that your parents or your partner are going to come to these appointments with you most likely, and knowing kind of when to say, like, I need to talk to my doc alone, because it is your life that you're discussing. The people around you love you very much, and it might be too hard or uncomfortable. So really protecting your privacy, I guess, is what I'm encouraging. Sorry, I feel like I'm rambling. Yeah, so sharing your story with those worthy of hearing it. So social media is a blessing and a curse, in my opinion. And once something is posted, it's there. You can't take it back. And not everyone in your inner circle is going to respect those boundaries. So just be mindful of kind of, okay, you get a new diagnosis. Do you then, I encourage you to take some time to process and to unpack that on your own or with your community social worker, or if you're in a hospital setting and they have a sarcoma social worker, awesome. If not, any oncology social worker, and ask like, okay, how do I X, right? There are no should statements with these diagnoses. You shouldn't know how to do this. This is not something that comes natural to anybody. So that's kind of my 2 cents on social media. So it's a blessing and a curse. And then connecting locally, either at your hospital or nationally with other peers, other folks who have the same diagnosis and understand what you're feeling and going through is very powerful. And then these are two slides that maybe we can kind of like email out to you guys in the sense of like how to find a therapist in your community if there isn't anybody at the local cancer center. Similar thing.
Yeah, we'll include it with the resources.
Yeah, all the above. So I'm gonna stop those. Yeah. Oh, nope, I went too far. Christy, you can take it back over.
Christy will take back controls. And yeah, we have a lot of really great resources that Jackie and Caitlin have generated that they do share out with their communities that we will share out as well. So thank you both so much for that. There are so many great resources. I'll pass it over to Caitlin before we get into our discussion and Q&A.
Thank you all. So Valerie, Tasha, and Jackie brought up some really great themes and points. So I just wanted to touch on a few of those a bit more when thinking about what impacts a young adult with cancer, especially a rare cancer at that. There are some themes that stuck out, which they already spoke to a bit, but really one of the biggest ones that I see often and feel is most important is just society's perception of illness, as Jackie was mentioning. It's not something that we view or talk about as a society that happens to young people. There's a lot of stigma attached to it, especially for people with sarcoma, something often I'm sure many before, whether they're a care partner or a patient or a caregiver, friend, ally, have never heard of sarcoma until that moment that someone has been impacted or you've gotten into this work. These disease names are very complicated as well, not easy to pronounce. And there's so much stigma that's attached to invisible illnesses, especially in the beginning of a sarcoma diagnosis, where it may not be visible outwardly until treatment has begun. So that can be really difficult for others to understand. And we often don't have a lot of resources available to young adults, unfortunately, just the way that our society and policies are designed, which can be really difficult. So as Jackie was mentioning, if you have a social worker or other resource at a cancer center or a community agency, that can be a great way to just see what is available to you and tap into some of those supports as you're trying to figure this out and process your diagnosis a bit more. But with just the rarity of the diagnosis and the stigma that's attached to it, and just how life altering and changing this can be with the role reversal and just the identity shifts of being a young adult in general, but then a young adult diagnosed with cancer, this is a hard time. And as Jackie mentioned, there's really not one way to deal with this or process the diagnosis. Whatever you're experiencing, whether it's deemed a positive or a negative emotion, is okay. And it may come in time. I know often when patients are diagnosed, you might not be ready to process some of that emotions. That might come later on in the experience, whether it's as you're getting used to treatment and figuring that out, or maybe once you've completed treatment. So really just being gentle with yourself and seeing how things feel for you and really trying to tap into some of the resources available, the peers. I feel like the connection is so helpful to patients, because your peer group probably and yourself may have never encountered a medical issue prior to this. So this, as Jackie mentioned, this may be your first experience with the medical system, and that is very stressful and overwhelming, especially in our country in America. So there's a lot to think about. There's a lot of things to consider. So just taking things at your own pace and figuring out what are ways that you can cope with this experience and begin to process it, whether that's connecting with a therapist or going to a support group, utilizing some of the peer programming, whether it's one-to-one or more of that support group, or seeing, or is it more of something concrete, like tapping into more of advocacy work, like with SFA, or utilizing art or some other coping strategy, just figuring out what works best for you and trying to see. I know there's a lot of processing with just who you are as a person as a young adult, but then to add this into the mix, and if you were very active before, just figuring out what do you like and trying to figure out what does bring you joy right now and to help you connect more with yourself and your community, because it's a really difficult experience to go through, as I'm sure I don't need to explain to anyone here, whether you've been diagnosed yourself or know someone who has. And as Jackie was mentioning, depending on where you live, you may or may not have a sarcoma specific social worker or even a social worker at a cancer center, depending on the resources locally. But just seeing what else might be available to you, whether it's tapping into a therapist and someone who works with those that are young adults, or those who have experience with medical illness and trauma, that can be a really good avenue for just trying to figure out how do you make sense of this and what is most important to you.
Thank you so much, Caitlin. I know we have some questions coming in that we'll share and discuss. But to kick off our discussion, something you all have kind of mentioned is this time of life where, and to kind of quote Valerie, you can't see your life beyond a certain point once the diagnosis hit, because as Jackie mentioned, an adolescent young adult diagnosis is in a time of life where these really big milestones are happening. So I'm curious, how as social workers, Jackie and Caitlin, you help your patients cope with that, and as Valerie kind of said, see beyond a certain point or see where you're at. I liked Valerie's visual of looking at your feet and saying, I'm here. But how do you help someone kind of navigate that? Because it's a pretty unexpected feeling in your 15 to 40s to feel like you can't see beyond a certain point in your life.
Yeah, I think that's a great question. And it, of course, varies patient to patient, person to person. But just, I think a really helpful tool can be mindfulness and just figuring out like how do you sit with the emotions and trying to reconnect with your body, because that's like especially in a time where you might be having a lot of pain or fatigue or other symptoms, but really just trying to rebuild that connection between the mind and the body, and then really focusing on what is most important to you, what big themes might be jumping out to you at this moment, and knowing like hour to hour, day to day, that might fluctuate and change, but just figuring out what do you need in that moment. And if it's like some days all you can do is send a gateway message or patient portal message, and drink some water and rest, that's okay. And the next day you might be able to tack on a bit more, but really just trying to conserve your energy and focus on what is the task in that moment that you need to take care of.
And to go off of what Caitlin shared, in the sense of it's also okay to not know and to sit with that uncertainty and just acknowledging, okay, right now I'm in survivorship, just got diagnosed, I'm starting treatment. That can be enough, in the sense of you're fighting for your life, you're trying to navigate a whole new system, and that is a well enough goal for the day, right? So short-term goals, long-term goals, they can kind of vary, and it brings up a good point in the sense of like time, right? Time gets distorted. Um, and that's okay. And sometimes it's helpful to not look too far ahead. Sometimes you need to just look at the day to day. There's no wrong way, but yeah, it's okay to not know what the future holds, and to be okay with, okay, I'm going to survive right now, and if I survive, I can worry about the other stuff later.
So I actually have a question that came in through the chat that I think is related to what you just mentioned, Jackie. Someone asked, how does a provider of any kind know when someone has processed their diagnosis enough to be ready to talk about things further? They shared an experience about offering resources or trying to bring up a subject that ended up bringing too early and it fully stressed out and kind of shut down the person that they were talking to? When is the right time to sort of try and intervene?
If I understood the question correctly, uh, body language is really helpful for us to kind of know what and when to maybe push on something. If and Chrissy, if I'm not answering it correctly, please steer me in that direction. But if I'm sitting with somebody and a topic comes up, whether I'm wanting to bridge maybe a harder topic, if the body language is you start getting, kind of tight or shallow breathing, things that tell me that, okay, this is a hot button, but maybe now's not the right time. I look at the environment. Where are we? Are we in Kima with a bunch of strangers listening? I'm not gonna harp on it. I'm not gonna, you know I'll circle back probably into another time, but it's really a slow testing of the water and then just meeting folks where they are. um yeah, I hope that answers your question.
Yeah, this is a
Grasp.
question that came in from some folks who are participating. So I'm trying to understand it as well as I can as well. So I think this also is relevant to another question that we had come in. So not all sarcoma patients have access to social workers who would be uniquely equipped to read cues like body language, for example. So what about other providers that a patient might be seeing, such as an oncologist? How do you see an oncologist or a surgeon or whoever else, other parts of the medical team? How do you see their role in survivorship and long-term care and facilitating that part of the sarcoma patient's care? That question is open to everyone, by the way.
That is a great question, and definitely right, will vary depending on what resources the oncologist has at their disposal, other parts of their team, like palliative care is a big part of our team, and just having these conversations, even, like during treatment, but then after treatment as well. But really will depend on the provider's comfort and also your relationship and rapport with them too. Um, some, right, have more comfort and training in that area of these difficult conversations or thinking about long-term supports and the emotions of being a young adult with a cancer diagnosis. So I think it really depends most on the relationship that you have with them and if you're comfortable kind of probing a bit more and seeing the provider's comfort. So understandably, it'll just depend on what's available to them.
And I think this is a great place to consider, resources and the resources that we will share out at the end of this. There are so many different resources that exist in the AYA community. And if you feel like you need to supplement your oncologist support with one of these resources, that is a really great option. So we'll share that as well. And I think, both Jackie and Caitlin have mentioned kind of setting boundaries in communication. And sometimes the communication that you share with the people in your life outside of the medical community also needs to be shared with your team. And communicating your needs to your team will help them better support you as well. But here are some of the programs or resources, rather, that can kind of supplement the care that you are given at your facility. They range from creative writing workshops to finding support in your career while also navigating cancer, to grant applications for fertility preservation, to one-on-one connection through Immerman Angels. So it's a very long and not comprehensive list. There's other ones out there, but some main ones that you can definitely find some support in to supplement with your team's support.
And I also want to add, to go off that, in the sense of, if you're sitting with your provider and you feel like they're not understanding what you're saying or they're really not catching your cues, I strongly encourage you just to kind of say, "Hi, I'm not ready to have this conversation. Um, maybe later, or I want to have my mom or dad or my partner here for this conversation," and know that that's okay. You're you're the one in charge of your care.
Mhm. Yeah, I think Jackie brings up a really good point that it's a relationship between a patient and their care team. You know, it goes two ways. I think it's very easy to feel like somebody in a white coat, you know, dictates how a visit goes. But as Jackie and Caitlin have all said, it's your life. So you are very much a factor in that relationship. And can feel free to speak openly with your team about what you need. And if you don't feel comfortable with that, finding somebody or one of these resources who can help you with it.
We have another question here. What do you see as a good model of a survivorship program? And what do you think would constitute the minimum services offered by an AYA specific survivorship program? I'd be really interested to hear the perspectives of kind of both sides of this discussion. Obviously, there's half of our panel that is on the provider side, but we also have the other half of the panel that has been the recipient of these services. So I'd love to hear both sides of it.
I can vouch for online services. Actually, somebody asked the question about timing. My social worker was brilliant in giving me a message on the portal with a bunch of resources in the very beginning that I could just refer back to when I needed to. So I could just have that always there, because in the beginning I was very overwhelmed. And once I had surgery and I had some downtime, I was able to join in on an online program for the first time for AYAs. And I heard other people talk about my life under their name. And I was like, oh my gosh, we're saying the same thing. And once I brought this up, then I was offered other options. And I've participated in Elephants and Tea writing workshops. This is how I discovered even that I liked writing, actually. I didn't use writing before as a tool. I was never even used to writing in a first person. Whenever I wrote something for school, it was always third person, past tense. But it was through Elephants and Tea. They have a journal that they mail out to you if you participate in their writing workshops. And that is how most of the time, how I process my thoughts now. So I find them very beneficial. I also find very beneficial community. So a support group that can talk and just tell their stories, because even when you're sharing, you're like, oh yes, I know what you mean. And having that space has actually made it easier for me to be present in my old life and not have cancer rob me of that too. So now I can listen to boy problems or, other things without getting easily annoyed, because I don't want cancer to rob me of that, the silly things that I should be also talking about. So those programs with support groups, writing and other arts, and obviously the comedy have been very helpful for me.
Yeah, I agree. Actually, Elephants and Tea was one of the first resources I participated in after my treatment ended. And I think that's kind of a point that I want to make is I think a good model of a support program is that people need different things at different stages of their diagnosis. What I needed in the really beginning of my diagnosis was vastly different from what I needed in the middle. And when I finished active treatment and then continued on beyond that. Um, so I think having different resources and kind of like a menu of options per se available for those different stages is really important. I think ones that stick out to me are um, confronting my mortality was a big one in the beginning and during treatment. Managing my identity and how that shifted throughout treatment was pretty big. And that all eventually kind of led into meeting other people I could connect with. It was definitely very isolating. And I think support groups get a stigma that can be really intimidating. I was somebody who really disliked the idea of them throughout treatment. And I eventually gave into it later with the help of my social worker. And it was one of the best decisions I made. And so it kind of took some warming up too, but having that connection with other people who know exactly what it's like to go through a sarcoma diagnosis as an adolescent young adult was really important, like Valerie said. And that opened me up to a lot of other things. So Elephants and Tea was a great way to be in community, but also if you're not ready for a support group, have that sense of community while also processing with journaling and other opportunities they offer. And then the further away from treatment I got, career was a big one. Navigating career, navigating return to work, navigating paying my own rent again after living with my parents and building that back up. So financial assistance, insurance was a big piece too. And so I think a good model of support is just having a lot of different checkpoints for all of the different milestones an AYA might be experiencing as they go through a diagnosis.
That's a really good point, Tasha. It's just right, like just seeing what do you need in that moment, um, and just looking at the bigger picture of all these resources because survivorship programs, right, are still not as available as they should be. And it's something I know, like, overall is a large focus for the future, but at present probably is lacking at a lot of institutions and really something that is we're working toward building on, but especially from like the mental health perspective or the concrete resources perspective, it's really utilizing these different organizations like Triage Cancer, for example, for more of the financial and insurance related matters. So just seeing overall what might be available. So it might be a few different programs, as well as seeing like from a therapy perspective, if that's something you're looking for, seeing like what are you struggling with in the moment, or what are you looking toward to process? Is it your identity changes? So maybe seeing like a therapist who works with young adults specifically, or utilizes a specific modality. Like Psychology Today is a great resource for just seeing like what are the different therapeutic modalities, which one might be most beneficial to you in a specific moment. So just seeing, it might not be specifically like a cancer specific therapist, but what themes and what trainings might they have to offer, and that you can do. You can send them an email or do like a 10 to 15-minute call with them for free to just see, hey, this is my situation and this is what I'm looking for. I don't know what I'm looking for, and just trying something out as well. So it's a lot of trial and error in survivorship, I think.
Okay, we have another question here. I'm wondering how services are being paid for, or if you have experience with this. As a sarcoma patient, and even in a large healthcare system, survivorship services are mostly funded by fundraising or by the patient, in my experience.
So so that's a hard one to speak to, in the sense that the Mass General, um I'm lucky in that I don't have to bill. I don't bill. So it's a free service here. I can't speak for all other institutions. But my understanding is most credited cancer centers do have free mental health services within the cancer center. So I would start by seeking out kind of the cancer center that you're connected with, either social workers or counselors or who have you, and ask before you start talking with them if there's a cost. Because that you don't, yeah, that's a really hard one, because I truly don't know enough about other centers, and I maybe Caitlin can share about the Farber, but I know Mass General, we're a free service. It's a supportive care service. It's part of your team.
Yeah, we have a similar setup. We mostly are available to patients who are in active treatment, and then some depend on the disease center or type of program they might have to offer. Like our young adult program operates a bit differently, and that's young adult program for all patients, regardless of disease. And then in our survivorship clinic, they may be able to provide short-term counseling, like just a couple of sessions, but it's definitely something that's we're working toward building on resource wise, but most of it is offset to the community unless it's like a support group or something, maybe a therapeutic group, which the therapeutic groups may bill. So it really does depend on the institution. And I know there's some nonprofits that can help with grants towards mental health services that are limited for funding, but it really does depend on the institution, which is tough.
And I think this is another great place to supplement resources. I know I keep going back to that, but Elephants and Tea does have a social worker on staff who leads a lot of their programs, which are free. It's a big plug for Elephants and Tea today, but there's a lot of resources that are that do take this into account, or like Caitlin said, do offer grants for patients to apply for mental health counseling. I know also there are therapists outside of institutions that offer sliding scales, and this can be like something you search for. I believe it's Psychology Today. Um, but yeah, I would lean into those free resources online, um, since it does differ, there's a variance between institutions.
I'm going to take just a second also to use this as an opportunity to mention that we, in just a few minutes, are going to share our adolescent and young adult sarcoma experience survey. And that's an opportunity for everyone to share their experiences, where organizations like SFA can kind of collect information about obstacles that you may be having as part of your experience. And knowing things like, I'm having trouble paying for mental health support, is helpful for us to be able to help advocate better for you and your experience. So just a thought for that as well. Helpful if I don't mute myself. I have a couple more questions here, and then we'll have to wrap up here shortly. But I have one. How can patients be celebrated? For example, Cancer Survivors Day. Can we convince providers that that these celebrations are beneficial, if they are beneficial to have, even though survivors don't necessarily pay for them?
That I'm curious Valerie's thoughts as a fellow survivor. My inclination immediately is to say it depends on the person. Um, I think everybody likes to be acknowledged and celebrated differently if they want that. Um, so I would say it differs between patients, and survivors, but it is still nice to offer. I think for me, it was celebrating different milestones when I wanted to celebrate them. Um, Actually, ending chemo was a milestone that I did not feel ready to celebrate until 2 years after. Um, and that was really tough for people in my life to understand. It was a variety of reasons. I think one is that there's a misconception that cancer ends when treatment ends, if it ends, or when you pass. So for me, it was a very hard thing to celebrate for a long time.
Yeah. Yeah, I think I'm not sure how I feel about an institution, or what they could do to celebrate like a big group of survivors. I think it definitely depends on the person. And when I have felt the need to celebrate sort of surviving, I just go and like treat myself. Like I just couldn't decide vanilla or chocolate cake, so I just got both. I wasn't intending on eating like both of them, but I was like, you know what? That's how I'm celebrating. And it just really depends, really how you want to do that.
Yeah, and I'll add from the provider perspective, I think following your patient's lead, I have felt very excited when I've come in with a milestone that I feel is important and saying, like, I drove to Trader Joe's for the first time by myself. Like, I'm so excited. And if my team was excited with me, that was the acknowledgement I needed. So I think for providers, it's kind of like Jackie said, picking up on the cues that your patient gives you is really helpful. But I know that there are these big survivor days, and I think it's nice to acknowledge it and say, like, you've been acknowledged, and then from there, if they would like a continued celebration, to go from there. I'll let the social workers chime in.
I'm a big proponent of it depends on the person. And I know that at Mass General, we don't have a big Survivors Day. We don't have anything that it truly acknowledges those who have continued on. So it has me thinking in the sense of what could we do? Could we do something? And I don't know, but it's a good question to think about. Yeah, it's food for thought.
Yeah, I agree with that. It's so individualized, which is hard, but just celebrating the normalcies. I know that can be huge for this, for young adults. Just the normal pieces like driving to Trader Joe's or, not having an appointment that day, not having to make a phone call. And that's a huge win. That's something to celebrate. So whatever makes sense for you, and maybe connecting with other peers who maybe want to have, like a specific day and tradition to celebrate. So that might be a good avenue to go down.
Okay, I have another question that I think is really interesting. Are there community building programs that can be practiced or offered while patients are receiving inpatient treatment? What's a good way of making those connections?
That's a good question. And I will say, so at Dana-Farber, we have outpatient social workers. It used to be both inpatient and outpatient, but we're now divided. So we have for our inpatient floor, there's inpatient social workers who cover, and I know they can build some connections there. So I can't really speak to it too much. I'm not sure for you, Jackie, it might be the same setup. So that's a little tricky. I know some places are more like inpatient and outpatient coverage together versus separate.
Yeah, it's very hospital specific, cancer center specific. Uh, there's not always that continuity between inpatient and outpatient. If your institution has outpatient inpatient within the same hospital system, and your social worker knows that you're going to be admitted and stuff, I encourage you to reach out to them and say like, hey, I have an inpatient chemo week, can you swing by? Or do you know of any other young adults that are on the floor that could also who are also there and maybe can poke their heads in, right, and that kind of stuff. So what we've been trying to do here is just kind of make those connections when folks are together at treatments, and letting AYA patients kind of share their cell phone numbers and that kind of stuff, so it is more organic than kind of saying like from 3 to 4 we're going to sit in the family room and whoever wants to come, because unfortunately since COVID that's not really allowed anymore. So that freedom to kind of roam a hospital floor, at least I think in Boston it's not really encouraged or supported by floors, especially my inpatient floor. So that's a yeah, so you kind of have to build your own, but if you have a provider, a social worker, see how they can help you kind of navigate that and make those connections, because they are so important.
Okay, I have one last question. I think it's a great way to end. I would love for each of you to answer this one. What do you think is the biggest need or gap in the AYA space as a resource? What would be the single thing that, as a patient, you wished you had, either at diagnosis or post-treatment, or as a provider, you wish you were able to provide? No pressure.
Who wants to kick it off? I guess I'm unmuted, so I can go. um, the biggest gap. It's a two-part answer. I'll try and make it quick. So the first one is at diagnosis, finding someone who could understand me. And I don't know if this one is as much of a gap as it is, the person's willingness at that time to want to speak with someone. I know I was a difficult patient because I told my team I was not willing to speak with anyone, and that was not good for me. It took a long time for them to help me come around to that. But I think there's like a potential to not destigmatize that, but make it more of a comfortable experience. And so I think that takes a lot of collaboration between patients, providers, advocacy organizations to make that something that is more natural, be it one-to-one or destigmatizing support groups. So I think that is a space that could use a little work, because as much as I was very resistant to it, it was the best thing for me in the end. And then I think navigating the jump from finishing active treatment to going into monitoring, that is a bit of a jump scare. whether you end up having a recurrence or you end up back in treatment at some point, there is just a jump scare moment between getting your diagnosis and trying to transition back into your daily life, because as an AYA, you're not really at the quote unquote end of your life. You're not older. You hopefully have a lot longer to go, and no matter how long your life is going to be, you still want to do something with that time. So I think the assimilation back into normalcy could use more support.
My response to it is, I don't know, take it for what it is, but I think that there's not enough buy-in from hospital systems to have the funding to implement good quality AYA support. I mean, in a fantasy world, that we would have an AYA waiting room, we would have an AYA infusion center, we would have an AYA, survivorship, we would have all the things. And most institutions don't have any, and we're trying, but if there's no funding, if there's no buy-in, we don't have the capacity, the time to do all the things that we want to implement. It's the infrastructure's not there. So I guess funding and buy-in from institutions would be my answer.
I I kind of second what Tasha said. There is such a big difference when you're being treated and you get so much constant, well, things to do first. You maybe are calling insurance or just crossing, your time is basically occupied by doing all of this. And then it's quiet soon after. And you're like, I feel like I'm missing something. At Dana, I don't know if they're doing it, but there was a 1 year out of treatment. I called it my reintegration camp. It was like a 6 week basically class that met once a week and talking about survivorship, because I had no idea that I would have this much trouble reintegrating back into society, that I did, and that really helped. And also I created a good community with other AYAs in that program. So they did have a post-treatment 6 week program, but you do have to sign up for it and kind of have to be in the know. I'm not sure if everybody knows, but I did do my reintegration program, which was really good and wonderful.
Yeah, I think making that something that's available to everybody at every institution would be awesome.
Yeah, I agree with all of those. Just increased access to peer connection and like those programming, like, and not just for right Dana-Farber, but for everyone would be amazing, like a collaboration between organizations to increase access for those who might not have it near them. And then my other wishes would be just ways to more organically have peer connection, which is hard because I know a lot of young adults don't want to necessarily be on Zoom. So like try and figure out that a bit, and ways to introduce patients together. And then my other wish would be pet therapy and animal assisted therapy, because it's on the pediatric side, but for whatever reason on the adult side we don't really have it, and that would be amazing. Yeah, and just I think also just increase access to mental health providers and social workers, similar to like in pediatrics and adolescents. There might be that might be for every patient at some institutions, but on the adult side, it can be harder to implement, and there's just not enough providers to go around, which is harder, like grant or like funding specifically for that service. So just more mental health providers.
Thank you all so much. Yeah, I second the pet therapy. I deeply considered sneaking my Yorkie into chemo, but that obviously did not happen for obvious reasons. But I wanted to take a moment here to remind everyone to let your voice be heard. We mentioned the AYA Sarcoma Experience Survey that we launched last week. This survey is so important for a lot of the things we've touched on today, and particularly how SFA can provide resources and support to the sarcoma AYA community. And we want to hear directly from adolescent young adults and their care partners. So please take the survey. It will pop up on your screen, so you can either take it immediately after the webinar or later. It's very short, but it allows you to really, share what's important to you as an adolescent young adult when it comes to support and resources. So again, you can choose to complete it right after. You can close out and take it later, but we would love to hear from you.
You can also find the link on our website or in our newsletter if you weren't able to.
Newsletter, social media, everywhere.
Yeah.
Also in the AYA Facebook group, we have a Sarcoma Foundation of America, Sarcoma Connect Adolescent Young Adult Facebook group. So if you're somebody who, is craving that peer connection and not sure where to start, this is a great place. Come introduce yourself. There's some chat in the group already. And we do post things like the webinar invitation, like the survey, and other resources like our discussion guide for you to take to your appointment. So it's a way for you to get some really useful resources and information, as well as connect with your peers in the community on a national level.
Okay, everyone. Oops, I just clicked the wrong thing. All right, so with that, we will be wrapping up our session. Thank you to everyone for taking the time to be with us today and sharing your expertise and experiences. We appreciate all that you do for the sarcoma community. Thank you to those of you who logged in today to be a part of this very important discussion. As a reminder to all of our participants, today's session was recorded, and a link will be posted to SFA's website within the next few days at curesarcoma.org, along with additional information about resources that we shared during today's discussion. This now just concludes our discussion for this afternoon. Be well all.